Good morning. Welcome to the weekly COVID-19 HHD Directors live stream. I'm Dr. Melissa Shelton, will be moderating the live stream. Today's 1-hour live stream theme entails the Employee Health Unit Support Role and information on emergency FMLA paid sick leave policy as it pertains to the COVID pandemic response. Again, after the comments, we will open with questions and answers. If you would like to ask a question, please remember to select the My Question tab located at the top right corner. You'll be able to write and post your question. Friendly reminder, there is a 10-second delay via the web. I want to welcome our director, Stephen Williams.
Good morning, everybody. I hope that everybody had a good, relaxing, and restful day yesterday. It was Easter. I do understand that a number of us worked on Saturday, and I'm grateful for your diligence and hard work. We tried to get it off, but it wasn't exactly approved. But yesterday, I'm sure you spent time with your families and on chores like I did, to some extent. Didn't do all that I needed to do, but I did. But welcome back. I know that we are at a different phase related to COVID-19. We've been at this for quite a while. Want to use a different format today. We're going to have a presentation regarding our employee health unit by our chief nurse, Tracy Fletcher Davies. She knows that I know her name. I've known her for a while. She's our chief nurse, but she's the employee. She's going to be our lead for our employee health unit, and she's going to explain some details regarding that unit to you. And I also wanted to have our assistant directors come up and talk a little bit, up to 2 minutes, underscore, about what's going on in their units, but also give us a quick snapshot of what's happening as it relates to their role in the response. I know you haven't seen it for a while, so I thought that would be a good idea since we're going into a different phase to introduce that. Without further ado, our chief nurse, Tracy Fletcher Davies.
Thank you, Director Williams. So our employee health unit is happy to serve in this capacity with the health department and service support to the team as we respond to the COVID-19 response. So Dr. Shelton, if you have any questions, I'm happy to answer.
At this moment.
So as far as the amount of staff that we have working in this capacity, there are currently 7 supervisors and allied healthcare professionals who have been tasked with monitoring COVID-19 cases and contacts within the health department. This team is working in partnership with the Bureau of Epidemiology and FMLA coordinators to ensure that we communicate guidelines and self-monitoring when on home quarantine and education regarding the return to work process, and that we're a resource for employees. When employees have additional questions about whether there are any vaccines or medications for treatment about COVID-19, we ensure we answer those questions based on the World Health Organization and CDC guidelines. So at this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials that are evaluating potential treatments. The World Health Organization will continue to provide updated information as clinical findings become available. Now, we have received many questions about whether individuals who are 65 and older or someone with underlying conditions should stay home. So according to the World Health Organization, older individuals and those with underlying conditions and medical problems like heart disease, diabetes, chronic health conditions such as respiratory disease and cancer, they are more likely to develop serious illnesses and have extended recovery times. So we recommend that this population is especially vigilant in adhering to precautionary measures and protecting themselves from COVID-19. Okay. And then another question that our unit is getting frequently is, what should I do if someone near me is sick? So information is power. We want you to be aware of the latest COVID-19 updates. So remember the facts. Take care of your health. Remember to wash your hands frequently and regularly. Make sure you're washing them thoroughly with soap and water. Secondarily, use a hand sanitizer that is alcohol-based that kills viruses. Okay? Maintain at least 6 feet of distance between yourself and anyone who is coughing and sneezing. That's because when someone coughs and sneezes, they can spray you with small droplets. And these liquid droplets from their nose and mouth will contain the virus if they are sick with the disease. If you are too close, you can breathe in these droplets, okay? But social distancing works. You just have to do it, okay? So these are the ways that you can maintain your health and help all of us to flatten the curve.
Yes, Tracy, and I noticed that most people in the room have a mask, and as you can see, I even have a mask. That's one of the ways that we're really trying to prevent transmission. We were talking before the deal about whether or not I should put this over my mouth and cover my face, but everybody decided that I shouldn't because y'all wouldn't be able to hear me. But we are encouraging everyone within the health department to wear their masks. Now, if you're sitting in your office by yourself at your desk or in your cubicle by yourself, it's okay not to wear it. But when you know that you're going to be interacting with other folks, we're advising that everyone wear their masks. So if there are not questions regarding this for Tracy, I'm going to ask Marlene to come up, where she's going to talk for up to 2 minutes regarding what's going on in her area and kind of tell us about her role in response. And we want to thank Tracy. She's going to be available for questions if you think of something, because within the next hour or so.
Good morning.
Good morning, Marlene.
Good morning, everyone. So for the Division of Disease Prevention and Control, I first really have to thank Richard Stansel. So many of you know Richard, the Bureau Chief for Tuberculosis Control. He really agreed to step up and assist me during this COVID response. So he's been sort of serving as the interim assistant director, taking the lead on many of our COOP-related activities so that we can continue our regular and routine business. So I just have to say thank you to Richard and Diane, because they certainly got immediately swamped with a lot of work. We still have lots of businesses with our grant submissions, with our timesheets, as well as even calls with our funders. As many of you know, we are almost exclusively grant funded in that division. So that work needs to continue so that we continue to have ongoing support for the work that we do. Other COOP operations that I'd like to update you on. Many of you know that we went through a couple of service modifications where we have consolidated clinic operations, and we've also moved to implementation of virtual field work, if you will, for those activities where it's appropriate to do so. So many of you in HIV/STD in particular, even TB, we've enhanced some of the protective equipment that you guys have for the work that you do, and making sure that we're safe and we're being as protected as possible. And then finally, I'll just speak to what we've been working on throughout the COVID response. I again continue to humbly serve with Decrecia Lembrick as one of your incident commanders for our department's response to COVID, and it's been extraordinary. So I'd really like to simply close by just thanking all of those health department staff who've been activated and deployed to do work you may not normally do. You've come with a willing attitude, you've come ready to learn and ready to serve. And so for me, I just certainly wanted to say thank you for that. Thank you for that attitude. Just recently, this morning, as a matter of fact, Dr. Purse and Angelina and Roger from the lab participated in a phone call, Stephen, with the CDC Foundation, and they have agreed that they would support most, if not all, of our requests.
Yes.
So we will have additional surge capacity support by the way of about 30 additional staffers. They will be employees of the foundation, but we can help drive who that is. But they will help for up to a year. We originally put in a request for around 3 months. So we're hoping that that capacity will start soon, and we may be able to keep that support for a little while longer. So just excited about that and about the work that we're doing both in disease prevention and control. It's what we do, and certainly throughout our COVID response. So thank you. Thank you, Stephen.
Well, thank you, and I appreciate you following up on that lead. Actually, that CDC Foundation connection came through our participation in the Big Cities Health Coalition, so I'm grateful for that. Lucretia, you're up for up to 2 minutes.
Good morning. Just wanted to give you guys a very quick overview of what our COOP activities are for my area, which is Children's Health Services, often referred to as Maternal and Child Health, but we are officially Children's Health Services. So for NFP and Healthy Families, which are our home-based case management programs, we have gone almost exclusively to a telephonic interview process. So as many of you know, many of the families that we engage with through both Nurse Family Partnership and Healthy Families come from communities that already are at a disadvantaged point. So it's important that we continue to engage with these individuals. What we have done is enhance our mental health and our behavioral health activities with these individuals. We felt it was critically important that we maintain that connection with those individuals. So we are continuing to reach out to those individuals. With WIC, we continue to serve in all of our WIC sites. With WIC, we have gone to an almost exclusively touchless model. We work very closely with the Department of State Health Services to ensure that we are able to service our clients as best as possible. As many of you know, the schools are currently closed, so some families are having a greater level of food insecurities, which is why it's ever more important that we in WIC continue to try to bridge the gap between the need and the food supply that families have. For immunizations, most of our service delivery is offered in our health centers. So that piece has been paused as it stands now, but we work closely with over 600 providers in Houston and Harris County to ensure that individuals are able to receive immunizations in their medical home. That part has not ceased. Providers are still able to receive vaccine, and they're still able to service their communities. I also have responsibility for milestone 1 and 2, which is milestone 1, ensuring children enter school ready to learn, and milestone 2, which is ensuring children read by grade level at 3rd grade. So Christy Rangel has continued to be actively engaged with the school community, and she was critical in ensuring that we had a link with the YWCA for child care services. So again, we serve families, some of our families in our most vulnerable communities. I won't say vulnerable families. I think the communities are vulnerable and not the people. So we have to continue to make sure that we serve in the capacity that we are charged with doing. So that's what we have for my area, and I'll stick around if you guys have any questions.
Thank you, Lucretia. The next person that's up for AD update, Valerie.
Morning. I actually think the caution to be only at 2 minutes was directed at me personally. It had nothing to do with the rest of the AD team, so I will try to adhere to that. As some of you may know, my responsibilities are over the Administrative Services Division. Some of my leaders are actually deployed. Darren, Asher, Shamika, Michelle, and Yvette are all deployed, have worked really, really hard to also try to support their areas, and I really appreciate that. One of the things that we've also worked with Stephen, the other ADs, and Melanie Walter, which she will talk about a little bit, is employee communication. Scott Packard has done a fantastic job with putting out the morning minutes. We've also created this venue, which other departments have actually joined us because they also want to access the information that's provided. And I've had 2 supervisor chats that try to answer the questions that supervisors will have about implementing specific policies and programs that we put in place as a result of COVID. The telecommuting initiative was supported by all of the ADs, but I also participated in trying to help provide information to you as well as the supervisors and managers. We have in some form or way of form 500 people that are telecommuting. Now, that's not 500 people that are walking out of the building and staying at home every day. Many people are not working at home every day. They are coming in 2 to 3 days a week and taking 2 or 3 days off. So I really applaud all of you for working hard to meet this social distancing option, but still really staying focused on trying to support the health department. I also want to thank Darren, Jimmy, Tim, and Charles who've been working on the 2021 budget. Hopefully we will get that submitted in the next couple of weeks for approval, and we will have that particular project completed. The disease containment managers have done a fantastic job stepping up to the plate. These managers were trained a few weeks ago by Barbara Sudoff, who's done a fantastic job with leading that initiative. They are specifically in place to assist and support all of you. Temperature checks, yes, providing masks. And I hope all of you got your hand sanitizer as you were coming in. But to have the DCMs in place allows people to get access to support from the employee health unit, as well as just having their questions answered. And the last area that has been working on your behalf, and many of you had questions about the cleaning service. It is not always perfect, but Claudette Manning has really worked really hard with janitorial services. We have 2 of them that are focused on daily cleans as well as specific location sanitation. So there's a lot of effort that's going in to try to support the initiative, and I'm very pleased with the leadership that has kind of made some of these things happen, in addition to working on deployed initiatives.
Quick comment from Deprecia.
In my haste to make sure that I stayed under my 2 minutes, I was reluctant to thank all of my staff, either those individuals that have been deployed or those individuals that continue to maintain the COOP activities. So charge it to my head and not my heart, because I truly thank you for every day you come in and you grind to the best of your ability, and I don't take that for granted. So from me to you, thank you very much for your daily efforts.
Thank you. The next AD up is Deborah. Good morning again. I apologize for we had some technical difficulties. What we're going to do, we're going to start back off with Ms. Deborah Moore, who works in the Division of Aging and so forth. So we will start from there.
Good morning again. My name is Deborah Moore, and I am Assistant Director for Human Services here at the Health Department. So just a little bit about what we have been doing during this time. We have centralized our client access program. While maintaining social distance, we are now centralized at the West End Clinic and the West End Multi-Service Center. We're continuing to process applications for health care. However, the number of requests have gone down during this time, so that staff are also working to answer calls from our hotline, our older adult hotline. And I want to thank my staff for the work that they've done through this pandemic, for the work that they've done to continue operations, and also the work that they've done in the incident command structure. Cheryl Shepherd is the manager of our client access area. In behavioral health, we've been very focused on employee care. Dr. Clamulia Richardson manages that area, and we have taken calls and meetings from staff, worked with them to refer them appropriately under employee care. In the reentry area, Latasha Selexman is the manager. We have continued to work with our participants via telephone. We're continuing to do case management and welfare checks for participants, as well as we're doing virtual training on anger management, thinking for a change, and other behavioral health training that will help our participants stay in their homes in a healthy and safe way. In our client access, in our community, in our Care Connect and our community cares program, Jennifer Graves manages those programs. She's currently in the ICS structure. However, she is continuing to ensure that we provide services and supports to vulnerable populations, that we link them to our partner agencies that can assist them at this time. And I want to thank her for doing that as well. In our aging program, we are continuing to ensure that older adults that are in our network receive food, medication, transportation, masks, and other items that they may need to keep them healthy and keep them safe and keep them home. We're also receiving and taking calls from older adults that are not enrolled in any of our programs as if they indicate that they have a need for food or if they have a need for masks, transportation, or other services, we can now provide those services and those supports to older adults. The aging program is grant funded, and fortunately during this time we have received funds to provide services and supports to older adults that are in our community and throughout our community, so they don't have to be already registered or enrolled in any of our programs. So if you know of an older adult that may have a need for food, transportation, masks, prescription medication, please have them call 832-393-4301. Again, the number is 832-393-4301. These services will be delivered to the older adult, to their homes, and again, that will help and reinforce the need for them to stay in their homes, but we want them to stay in their homes safely and in a healthy manner. Thank you.
Thank you.
Well, thank you, Deborah. Next, Patrick P., Environmental Services.
Good morning, everybody. I'm Patrick Key, Environmental Health Services Director, like Stephen said. I just want to say how proud I am of our whole department, everybody in the department, for the way that they have stepped up and responded to this thing that's never happened before in our lifetime. Our people, you know, it's like I heard Christopher Sparks say on one of our calls the other day. He said it was like when people were running out of buildings, our people are running in. And I'm so proud of the way everybody has done their job, not just in environmental, but the whole department, the way people have worked together, come together, and kept working when people were scared. And the sanitarians have done nearly 3,000 inspections, disaster responses to things. We get complaints about people not social distancing, and we go out and do them. We go back to restaurants and grocery stores when somebody's had COVID and help the people to how to clean up and what they need to do about it. And we haven't stopped our services. We're still doing routine inspections on the places that are having trouble, and we're responding to complaints. We're still doing the BioWatch program. We're still sampling the air. We're still doing all of our other services. We're still inspecting ambulances. We're still inspecting food trucks, and everybody's still working on everything, and I'm really proud of them. Thanks.
Well, thank you, Patrick. Patrick is the recipient of pictures and telephone calls from me all times of day and night. And instead of it being ambulances without current decals on it, now it's pictures where people in stores where they're not practicing social distancing. Or else it's a phone call about, okay, Patrick, they had a couple of positives in this grocery store or facility. It's been clean, but they're wanting advice. And I've gotten really good responses. Thank you, environmental health folks that have gone out, who have actually coached a number of businesses on how to stand back up and how to deal with the impact of having positive workers in that environment. So I'm grateful for that.
I do also want to say, I forgot about vital statistics, but they've been here every day. We're not having people come in live in person to get their birth certificates, but we're doing them online. We're helping them on the phone. We've waived our fees for delivery. And, you know, sadly, people are still dying and they still need death certificates, and and we need those too. And those people, everybody's helping out and doing and we're still doing our services. I appreciate everybody. Thanks.
So grateful for everybody. Diddy, you want to come on up, cover your area? I don't know whether y'all covered the clinics, but you can give us somewhere what's going on there. Since we have to lead our COOP response.
Good morning, everybody. I'm Judy Harris, Deputy Director and Chief of Staff, and what my area has been doing is providing a lot of support overall for the department. Amber Haig has really stepped up and been the staffing coordinator. She's coordinating staffing that supports the ICS response as well as COOP operations, and COOP is our continuity of operations. So this situation is a little different than we usually have when we're doing hurricane response, because usually we're pretty much shut down. All of our services are shut down except for some very essential ones. But here we're also providing normal services. It's normal as modified services, as well as doing the response. And so what I've been doing, Stephen asked me to do, is coordinate inside our COOP operations. So I'm having daily briefings with our leadership team, our assistant directors, to identify any issues that are coming up on a daily basis. And as you know, things are changing daily. And what we've done is coordinate the ramp down of the services that we normally provide. And so all of you heard the other ADs mention already how they have modified some of the services that they've done. I wanted to talk a little bit about the service modifications in our health centers and multi-service centers, because Sally is not here. Sally Diaz, who's the assistant director in that area, but we've consolidated the clinical services into one primary site at Northside Health Center. But in response to some needs of seeing follow-up people, they have opened up some limited appointments at Sharpstown and Sunnyside to address the needs in those communities, because some of the people were having transportation issues getting to that one site. And we have consolidated dental services down into one site where they are seeing emergencies only. Our multi-service centers are only open to clients, tenants who have services ongoing in that site. Other than that, they are not open fully to the public. So we're also beginning to look at how, when the city and the county opens back up, how we would ramp our services back up. We don't anticipate that we would just go whole hog the first day, because we're still in response mode. And so what we've done is look at how we have staff deployed. We now have a dashboard, thanks to Amber, that and the assistant directors and the staff that they have appointed, where we now know all the people who have been deployed, where they're deployed, who's available for deployment, because we anticipate as we go along, we may need more people to be deployed. In my particular area, outside of the human services area, I have the Office of Program Development, Planning, and Performance Management. Two of those areas are fully deployed. Everybody in performance management is deployed. Everybody in planning is deployed. I want to thank Melissa Shelton, who stepped up and agreed to facilitate these webinars, and she had requested to work from home. And then when I looked at it, I had approved everybody to work from home, and I was like, uh-oh, I don't have anybody here to support. And I called Melissa and said, can we work something out? And she said, sure. I don't live that far away. I'll be happy to come here. She's dedicated, so I want to thank Melissa for doing that. And so the other staff in the other area, Patricia Watson, in charge of adolescent health, she's deployed, but she's deployed from home, but she's doing work with ICS Response, and her team are working on grant deliverables as related to some of the CDC grants. And we have a grant from HISD to provide client access, to link people to client access services. So they're still performing some of that. The CDC program is figuring out a way to deliver the glasses to the schools, since the schools are closed. And chronic disease is providing telephone services, and most of those staff in those areas have been redeployed to the ICS Response. So on a daily basis, we're trying to manage the services that we're still providing, addressing any of the employee issues that come up or any of the service issues that come up, as well as supporting the response.
Okay, thank you, Judy. While Scott is coming up, I just want to acknowledge the work of Paula Johnson, our Bureau Chief for the Area Agency on Aging, and one of our staff members, Beverly Brownlow, who makes sure that we're taking care of our seniors. Deborah reminded me that she had forgotten to acknowledge that staff, but these are people that we really know are doing their job as it relates to supporting seniors. Scott.
Sure. So, the nuts and bolts of what we've been doing isn't really that different than what we normally do. We're pushing out information on the platforms we have, right? So that's things like the news media through news conferences, news releases, citizens net alerts, emails, flyers, graphics, those fact sheets, posters, those types of things. What's different about a crisis communication scenario is the volume is through the roof, and it's all right now. So that's what we're working through. We try our best to get ahead of information, to get materials ready to support new things that are being announced. That's not always possible. Sometimes you learn about things that are happening on live TV during a news conference. So that's always an interesting challenge, but it's one that it's just the way it works. We make it happen. Stephen's been doing these shows on HTV that have been really well received, with Dr. Shaw and Dr. Hurst talking about what's going on with the local health authorities. So we share that information as well. Porfirio, David, the webmaster, and Bob, we're all just, trying to keep up and highlight what everybody else does. People try to sometimes give us the credit, but it's in reality, we're just trying to show what everybody here at the health department is doing.
Yeah, I really wanted to acknowledge that, though, because it has been a significant increase in the volume of work that y'all have been doing, and I think you've been really on the spot and being responsive to questions that folks have. So I wanted to acknowledge that. I'm going to get into the questions. There are a couple of questions that people have already asked. And first is, have we reached our peak? If not, when will that happen? No, we haven't reached our peak yet. People are projecting that it might be anywhere from like this week over the next couple of weeks. I think the answer is that we really don't know. Our projections are just that, projections. We haven't really tested as much as I think that we would like to have tested, which would have given us a better idea of that. Hopefully we're opening it up a little bit more. We'll just have to see how it goes. The governor has states that he wants to open non-essential services again. Will the city follow lead? You know, that's going to be dependent on the mayor and certainly influenced by the county judge. But it all depends on what's going on, you know, here in Houston and Harris County. I think that we can look at what's happening in other cities and kind of project what might happen here, but we are a little bit different. And that was the next question: what makes Texas different than New York City? We're not as densely populated. That is, and we don't have as many people. Those are two significant differences. I think that has really influenced what's going on here. But yes, the next question was, are we going to see an increase in COVID cases? The answer to that is absolutely yes. Are we going to see additional deaths? Sad to say, but probably so. Even yesterday, I was talking to my boss, and he mentioned that an acquaintance of his had a father or a spouse to die. And so that's, you know, unwelcome reality we're dealing with here. We're dealing with COVID-19. I think the key here is to be flexible and adaptable in our approach and be open. I don't really, since we're in a government agency, can't start talking about religion, but yesterday I did hear a sermon that had some practical realities to it, and it talked about, you know, the symbolism of the cross. And one of the things, actually, it was Wheeler and Pastor Cosby, and he mentioned, you know, that, you know, oftentimes we go through trials, suffering, that is preparing us for things to come. And that's kind of how I look at it. Most folks, you know, basic language that say, you know, it is those tests that you go through, those challenges that you go through that actually make you stronger. And from a spiritual standpoint, I think that's what he was talking about yesterday. And so I'm hoping that, you know, this test, this trial that we're going through, these challenges that we're going through related to COVID-19 will actually help us become more adept and stronger in our work in public health.
Thank you. Next up, we're going to have a quick overview in reference to our human resources. So I would like to welcome.
Oh, I missed somebody, yeah? Why don't you just say that? Come on, Melanie, hurry up so they can ask questions. They didn't put your name down here.
Good morning. My name is Melanie Walter. I'm the Client Relations Manager for the Human Resources Department. I came to answer just a few questions that I received from you guys. I'm not sure if you have the questions queued up, but I do have a list.
Oh, go ahead. Talk.
Sure. I don't have childcare. Do I have to come to work? The short answer to that question is yes. Unfortunately, that is the short answer to the question. But what I want you to do and what I encourage you to do is exhaust all of your options. Speak with your supervisor, speak with your management. There are certain things that you can do in regards to telecommuting. Also in regards to the emergency paid sick leave. That policy is very new. It just came out within the past week. What I want you to do with that, excuse me, if you have questions about it, go ahead and email ffcra@houstontx.gov. They're going to have all of the information that you need in order to move forward with that process.
But wasn't there a program that said that they provided some support for folks? What is that the number that you gave me?
Yes, I know that was actually the paid sick leave policy, but yes, there is another phone number in regards to childcare. There was an email that came out recently, and I'll make sure we get that to Scott so that we can send that out to you guys as well.
Okay.
Workers' compensation. If you believe that you contracted COVID-19 while on the job, you can apply for workers' compensation. The mayor essentially said that it will be approved. You just need to go through the process. If you have any.
Wait a minute. You can go through the process. Folks, the reality is that it is going to be hard to prove.
Oh, yes.
Like if Will came in and told me he had COVID and he caught it at work, and I'm going to ask him, how did you catch it sitting in your office?
He is right. Let me change that. It will be accepted, not approved. We will certainly accept the workers' compensation claims.
Yes.
So they will come through. They certainly will come through. Whether or not they're approved, that goes through TriStar. we won't see that, or I won't see that anyway. Why can I know the name of employees that have been confirmed positive? That's,
I ain't no health department employee that's sick. I mean, come on, y'all. You're working in the health department. Y'all know about HIPAA?
yes,
Y'all know how much money we could lose for
Yes.
disclosing information like that? Come on, let's get real with this. Come on.
these are the questions that you guys are
Even
answering.
if
So
you
we-
know, you don't reveal it. I mean, come on. I told
Exactly.
y'all last time, remember you're working in the health department. There are rules that we have to follow and we have to respect those. Suppose it was you.
Absolutely, absolutely. There are people in this workplace that will be diagnosed, it will happen, but you're not going to be notified. It's just going to happen. In addition, so what happens after employees apply for emergency sick leave? How do we know if it's approved? You should receive a direct communication from the email address that I provided, the ffcra@houstentx.gov. Again, if you have specific questions regarding that, email that number. There are trained professionals on the other side that put together that policy that are going to have the best information for you. I understand that sometimes you get comfortable with certain folks within HR, but you want to be able to email directly to ffcra@houstentx.gov, and they'll give you the answer that you need. Since employees that are, improved for EFMLA will only get 2/3 pay for not having a babysitter, how long will the accrual leave be converted for the remaining 1/3 of pay? Again, that is FFCRA, but that really would be a code within Kronos that's under the ARA branch, so that wouldn't be an HR question. But certainly, FFCRA would be the email address that you need to get in touch with. That's all I've got.
Okay, one of the first questions are part-time employees working from home? Are part-time employees working from home?
Yes,
I mean,
yes, the answer is yes.
The next one has to do with clocking in and clocking out. If you're activated to work on COVID-19, are we just clocking in or clocking out in Kronos, or are we just filling out the disaster timesheet?
If you've been activated, whether or not you're clocking in and clocking out or filling out the timesheet, I can tell you what I think, and y'all tell me whether I'm wrong, because when I was out at the site, I asked folks about that. They are actually filling out timesheets on the site.
So they sent a communication said that none of them should not clock in.
non-exempt are filling out the timesheet. Filling out, signing in, they sign in. Then Shamika takes that, she takes care of it.
Okay.
But exempt, everybody should be signing in and out from the signing sheet. That signing sheet is handed to Shamika, who then can deduct the time.
Okay, just in case you didn't hear that, everybody should be signing in and signing out. And then those sheets will be handed to Shamika and she'll take care of that.
Okay. Is it true now, since you've already discussed earlier about the telework at least 2 to 3 days, if so, are there any exclusions and is it universal?
I didn't hear the earlier discussion.
So telecommute, again, is a decision that's made between your manager and your AD. And that's solely based on the responsibilities that you have and whether those responsibilities can be done at home. So that's the first step. And then they also will look at whether, because a lot of employees who are doing it 2 to 3 days a week are doing it at the request of the employee. It's not necessarily the manager who's saying you need to come in, but many of the employees are saying, no, I want to come in. But also a manager may require you to come in because there's certain work that can only be done at the office. For instance, in one of my areas, there's a day when some of the managers or some of the employees have to come in because they need access to certain equipment, they need access to certain people, and the only way they can do that and complete their responsibilities is to be in the office.
Okay. One last question. The line to get in the building today was kind of long due to getting temperatures. Will managers be instructed to give the employees 15 minutes for missing the window to clock in on time.
No, they will need, as we've said, and you know, maybe I need to remind everybody, you need to come in a little bit earlier to make sure that you accommodate, or you know, make sure that you compensate for the fact that there will be perhaps a line coming in. Now, we tried to put 2 people down there at those times. Sometimes that is those 2 people are available, and sometimes it's really hard to try to do that. But you should plan to come in a little bit earlier so that you can clock in.
Thank you. Stephen, do you have any final director comments?
Yes, again, I just want to thank you for the work that you're doing. You know, a lot of times we talk about how as public health workers, employees, we go unnoticed. But I have to tell you that I've had people like stop me in the streets and say, you know, we appreciate the work that your department is doing. We think that y'all are doing a good job in your response. And from my perspective, I'm wondering, well, how do they know? You know, so, you know, the thought here is that people are really watching. They're paying attention to what's going on. They're seeing whether or not we're getting, you know, overly excited and not really staying the course. And so I'm grateful that you are staying the course. You are doing a good job. I know things are stressful. Things change from hour to hour. As a matter of fact, after being up here for 15 minutes, I had to go take a call, pull Marlene out of this meeting. And now we are going to do a press conference at 12 o'clock. That's the way it is. We have to make sure that we maintain our personal health, both physically and emotional, because this is stressful for everybody. And if you're not in good shape, you're gonna really falter. So take care of yourself so that you can take care of other folks. I look forward to having this conversation with you again next week. The questions, let me know that at least y'all are paying attention to some of the answers that we're giving. I know that, you know, we'll continue to do this for as long as it's meaningful to you. If you have an opportunity, I think that someone mentioned earlier, Scott mentioned earlier, I do have Dr. Peirce and Dr. Shaw on a live stream on Thursdays that you can actually see at various times. But it answers a lot of questions specifically related to COVID-19 and what's going on in this community, and opinions from those docs about how things are going. I appreciate you. I'm grateful for what you do, and I am proud to be your leader during this unprecedented event.
That's much to say. Thank you. This wraps up this week's live stream, and please stay tuned for next week. Thank you.